It's some new technology introduced by some local folks here on Comunidad Valle. Is Robert Lopez, the co-founder of Savant Care, and Vikas Kedia is a CEO of this agency. We'll talk about what are we talking about here. We do have some video from your website and then some images that y'all sent us. But what are we talking about here? What are we talking when we talk about technology and mental health?
Sure. So essentially, what we realize is that the technology today in behavioral health, it's very much the same as it was 30, 40, 50 years ago. There really has not been much improvement. You look at different medical fields, you have EKGs, you have different monitoring tools that were developed for different specialties, but in behavioral health, it's been fairly stagnant. There hasn't been any much improvement there. So what we have done is, we are a clinical facility, but we also do a lot of R&D at the facility as well to develop new technology to help bridge that technological gap and also help solve some of the access issues.
R&D being research and development.
Correct.
Okay. And so what difference has it made, for, in layman's terms, for folks who might not understand, what have we done technologically to help us understand mental illness?
Sure. So mental health has two basic problems. One, there's no tracking and there's no prediction. For example, if I have blood sugar, my blood sugar can get tracked today. My doctor can actually see how my blood sugar has changed over the last 1 year. But if I have depression, my doctor doesn't know how my depression has changed over the last 1 year. And I actually had a mental health issue. So we started this company because I personally faced this problem where I was seeing a psychiatrist for anxiety. And he gave me a medication. I had side effects. He tried some other medication, and then he was changing the medication and trying to see what fixes my anxiety problem. And a year down the line, I asked Dr. Kaiser, Dr. Kaiser, do you remember what happened when I was on Lexapro 6 months ago? And he looked at me and he smiled that, no, because I don't.
Wow.
And
there's nowhere to track it.
There's nowhere to track it. And Dr. Kaiser, Dr. David Kaiser, he had become a friend of mine over 1 year, seeing him every couple of weeks. And I asked him, like, is that only with you or is that with everyone? And he again looked at me and he smiled and he said, I'm sorry, but that's how it is.
Because when you take maybe a blood pressure test, they give you a baseline.
They
this
give
is what your
you a
baseline is.
They give you a number.
There's no baseline.
There is no baseline, there's no number. But it can actually be done. It's not being done because it requires somebody with a lot of experience in computer science and a lot of experience in mental health. And
two completely different realms.
Two very completely different realms. Now, interestingly, what happened was that I got married to a psychiatrist. She's a faculty at Stanford, and I was expressing my frustration with her that I want to find the right medication that will help me, but we don't even know what's happening every time I change my medication. And I used to do research at Stanford on pattern recognition, understanding patterns, trying to make sense out of a lot of data. And as we started talking, and then Robert was a friend of mine, I was expressing my frustration with him that, Robert, I find it hard to be in a social setting because my anxiety gets too much of me. And then Dr. Parikh, our another co-founder, we have 4 co-founders, me, Dr. Savant, Dr. Parikh, and Robert. So we talked about it for 6 months, and then we said, well, somebody must be doing it, Vikas. Let's find you a doctor in the Bay Area who does it. So you can, we looked around, but we did not.
And you said, if nobody's doing it, we're going to do it.
It wasn't like that. It was more like, well, nobody's doing it, and it wasn't such a confident thing that we will do it because, there's Stanford, there's big places. So we spoke to people, we spoke to my wife's colleagues who are more senior to her at Stanford, that why doesn't Stanford do it? And then we found that not only does Stanford not do it, but we don't even see any hope of it happening in the next 5 or 10 years. And the reasons for that are structural. And the structural reasons are that doctors cannot do technology, and the guys who do technology, they can't do medicine. It's very So, and at that time, we decided to do it. Like,
So let me ask you this, because some folks might want to know if they have maybe a family member who has mental health issues. What is your technology now able to do for them? Are you able now to track progress and whatnot?
Yes, so the technology that we've actually developed, we're actually able to track someone's symptoms across time, across medication, across social life events, and we're actually able to. We're actually developing a mobile application as well. My colleague Vikas can go a little more detail into that, but it will actually be able to detect an oncoming mental health episode. So there's been data
that is the second part. So tracking is the first problem. And the second is prediction. For example, my cardiologist today, at least in very advanced settings, can actually predict if I'm going to have a heart attack. And when you have a heart attack, your heart muscles actually become weaker. Similarly with depression, when you have a depressive episode, your pathway for depression becomes stronger, so you're more likely to have another depressive episode. So in some way, if I could predict you were going to have depression, if I can prevent it, it's not only that I saved you 2 weeks of locked in a room crying, but I also saved you the likelihood of becoming, the probability of you having more depressive episodes.
That's pretty amazing. I need to show you a website for more information. It's called savantcare.com. You can read all about this new technology, and again, it's all local. Any final thoughts? We only have a few seconds before we go.
Sure. So I'll just leave you with a thought. If you were going to get depressed a week from now, the amount of time that you talk on the phone actually start to decrease today. The amount of movement that you do with your phone. If you're going to get depressed 3 days from now, if you're moving a mile today, if your phone's moving a mile today, tomorrow it would move less than a mile. The day after tomorrow it's going to move less than a mile. So I just gave you two very simple features. In our machine learning algorithms, we call them features, with which you can actually predict.
Very interesting. Thank you so much for that. We could do a whole half hour, I think, on this technology. Thank you so much for the work that you're doing. A lot of families of high interest. Thank you so much.
Thank you.
All right. And up next, you're on Comunidad del Valle, the Mexican Consul General of San Francisco. Stay with us.